The coronavirus pandemic is expected to cause a surge in deaths from another deadly virus, HIV. There are fears that there could be an extra 500,000 AIDS deaths this year alone.
WHO is deeply concerned about the impact of COVID-19 on the global response to HIV.
More than 70 countries say they're at risk of running out of the anti-retroviral drugs needed for the daily management of the condition. What's more, HIV patients who aren't on ARVs are thought to have an increased risk from COVID-19. So how can we protect people with HIV during the coronavirus pandemic? The coronavirus outbreak is endangering the fight against HIV, and that's becoming a growing problem, particularly in African countries, where many lives depend on anti-retroviral drugs, the very ones now becoming scarce because of the pandemic. DW's Adrian Krish reports from South Africa.
Tembi would have preferred not to come to the clinic today because of the coronavirus and to avoid questions from neighbors. Tembi is not her real name. She prefers to remain anonymous.
Are you ready?
She is HIV positive and wants to make sure her one-year-old daughter does not become infected.
My family knows.
But your friends?
No. Because they like to gossip. So people, they judge you. It's wrong, it's not right, because you don't know your future, what will happen to you after all. So you don't need to judge person.
1 in 5 mothers in Khayelitsha township is HIV positive. A few years ago, 2 out of every 5 children also had the virus, but now the chances of HIV being passed on at birth are less than 5%. South Africa has made significant progress in the fight against HIV. The government pays for the medicines, and aid agencies like Doctors Without Borders help with education programs. In normal times, a group of mothers with HIV meet here once a month, but the corona crisis means the meetings have been cancelled.
Our mothers do gain a lot from the group sessions, discussing with peers and having also time to discuss with the facilitators and things like that. So now that the group sessions are not happening anymore, it has really affected postnatal clubs.
The medics now counsel the mothers on a one-to-one basis. HIV is still a serious problem here.
The hospital is much emptier than usual. Because of COVID-19, many patients avoid hospitals and therefore don't have access to their medication. Experts believe that this could have a strong negative impact on HIV/AIDS, but also tuberculosis patients in the future.
Tembi knows her medication significantly increases her own life expectancy. Her hope is that in the future, HIV and corona will no longer be a danger to her daughter.
Earlier, I spoke to Dr. Shannon Hayter. She's the Deputy Executive Director of UNAIDS, the Joint United Nations Program on HIV and AIDS. Just this week, her organization, along with more than 70 other countries, warned that the coronavirus pandemic could lead to a dangerous shortage in life-saving anti-retroviral drugs. I asked Dr. Hayter why.
Yeah, we have sort of these colliding epidemics right now of HIV and COVID, and we have to make sure we respond to both. And so, number one, on a really practical level, we've started to see some really good and creative, resilient approaches to making sure services continue. But on the larger scale, we are absolutely seeing the risks for drug treatment shortages. There are barriers in some cases to raw materials getting into countries so that production can happen. There are barriers to produce drugs getting out of countries and into the countries that need them because of COVID restrictions. And so it's a really important dance to be monitoring where shortages might be and problem solving to make sure they don't interrupt treatment.
Now, what would these shortages mean for people living with HIV in mainly developing countries?
Well, we've made tremendous progress in the HIV fight since the beginning. And we just put out new numbers that showed over 25.4 million people worldwide are now on HIV treatment. But we really decided to say, well, how bad could it get with COVID? What happens, for example, if there were a 6-month interruption in all HIV treatment services in sub-Saharan Africa. Now, we don't plan on that happening, but we have to look at that sort of bad case scenario. And doing some modeling along with WHO and the HIV Modeling Consortium, we found that a 6-month interruption in treatment services would lead to an additional 500,000 deaths from AIDS in this year alone. That would double the number of deaths in sub-Saharan Africa and actually set us back to 2008 response levels. So we lose a decade of progress in just 1 year.
Shannon, are people with HIV more likely to suffer from a severe COVID-19 infection?
You know, we're learning as we go on that. There is some new data out of South Africa, which is one of the first countries affected by COVID that also has a very large HIV epidemic. And they are seeing that there is some additional severity in people living with HIV who get COVID. It's not as bad as for people who have diabetes or existing lung disease, but of course, people living with HIV are aging and have those things too. So it is particularly important that people living with HIV take precautions to try to avoid getting infected to begin with, and that we hope to learn more as, you know, treatments evolve, vaccines evolve, et cetera.
Now, speaking of precautions, there are HIV patients that are avoiding hospitals out of fear of contracting the coronavirus. How big of a problem is that?
Well, it's a big problem if we're not offering other solutions. So one thing about HIV care is for a number of years now, WHO treatment guidelines have really promoted this idea of differentiated service delivery or community-based delivery so that someone living with HIV doesn't have to go to the clinic every month or every 3 months just for routine care. The idea that someone living with HIV has their HIV under control could get 3 months of their medications in one visit and then not have to go back and forth. But a lot of countries before COVID were really slow in implementing those kind of practices. Fortunately, we have seen a major scale up in a number of countries of putting those practices into place. Multi-month dispensing, community-based delivery, community-based care, long-distance telephone consultations, and those kind of engagements for questions. So in countries that are moving to put those alternatives into place, we're seeing a lot less interruption of people's services. But in countries that are not moving to that community-led, community-based models, it's a problem.
Shannon Hayter, Deputy Executive Director of UNAIDS, thank you for speaking to DW. And now it is time for your questions about COVID-19, and our science correspondent, Derek Williams, as usual, doing his best to answer them.
I've heard researchers talk about trying to mute the immune response, but also saying that a younger, stronger immune system is more successful in fighting off COVID-19. Isn't that a contradiction?
To understand the apparent contradiction here, you have to understand that there are different stages of COVID-19 that patients can go through. The first is usually an initial infection in the upper respiratory tract, and that's usually where it stays with most people. That's where having a strong, fast-acting immune system is really great. It's able to keep the disease in check and eventually wipe it out. In some cases, it keeps it so effectively in check that you might not even notice that you had it. But in more severe forms of the disease, if the virus eventually makes it to the lungs or to other organs, it can kick in a severe immune response. And when that happens, the immune system can start attacking not just disease tissue, but healthy tissue as well. That's when doctors have to step in and try to mute the immune response with drugs, because if it spirals out of control, it can kill you. But striking a balance between letting the immune system do its job and reining it in if it spins out of control is pretty tricky.
Can you tell us more about dexamethasone?
Dexamethasone is one of the drugs that doctors now prescribe at that critical stage of COVID-19 that I just mentioned, when the immune system has gone into overdrive and starts attacking healthy tissue in the body. A major study in Britain that's still in peer review discovered that in critically ill patients who need respiratory support, the compound lowers mortality by between a fifth and a third, which is actually pretty huge. Dexamethasone is what's known as a corticosteroid, and it's widely used to treat many different conditions that cause painful or dangerous inflammation. It's also an immunosuppressant, so it can help calm down the immune system when it's running amok. But that also makes doctors wary about giving patients the drug too early when the immune system needs to be active. It's not a new drug, but one that's been approved for use for well over 50 years now. So it's cheap, it's widely available, and perhaps most importantly, production of it can be ramped up quickly.